Are you hungry for the latest news and trends from the internet? Welcome to What's Cooking on the Internet, your one-stop shop for discovering the hottest digital delights. Hit that subscribe button and let's get cooking.
Is having a baby a luxury? Tell us what you think in the comments. The wild cost of having twins in America with birth rates dropping. Should having a baby really be a financial nightmare or something society supports as a basic right? A new mom of twins recently went viral after sharing her insane childbirth costs in the U.S., sparking a huge debate about our healthcare system. Emily, a new mom, posted a detailed breakdown of her medical bills after delivering twin girls, and people on social media were absolutely floored. Her story gives us a harsh look at the financial maze that is used maternity care. Here's what her experience really highlights, making us think about the bigger picture. The insane starting price. Emily's own care for a high-risk pregnancy at 36 weeks was billed at over $120,000. This just shows how ridiculously high and unclear the base costs are in U.S. healthcare, often having nothing to do with what care actually costs. It makes you wonder why essential services are priced so insanely high even before insurance gets involved. Out of pocket, even with great insurance, even with what she called great insurance and a low deductible, Emily still shelled out over $2,000 for her own care. This proves that even good insurance can leave you with a huge bill for something as basic as having a baby for many families. $2,000 is a massive amount, which could easily stop them from having or growing their family, especially with all the other baby costs newborns billed separately. Maybe the most shocking part: Emily's twin babies were billed separately for their birth, adding up to almost $30,000, plus another $750 out of pocket for their deductibles. The idea of billing a newborn, who obviously can't pay, just shows how healthcare has become a commodity. It makes you wonder if a human being should really start life with a financial debt, adding stress and confusion to an already crazy time for new parents. Or interventions, major bills. A single visit for headaches, which included 2 extra-strength Tylenol and a blood draw to check for preeclampsia, was billed at over $9,000. This story really highlights the insane markups and total lack of transparency in medical billing. It makes you question what fair pricing even means, suggesting a system where even small things can cost a fortune, making it almost impossible for patients to understand or fight charges. Complex deliveries, crushing costs. Her C-section and 4-day hospital stay after birth alone were billed at over $65,000. This just shows how financially exposed people are when they face unexpected complications or need special care during childbirth, things that are often medically necessary and can't be avoided beyond these specific numbers. Emily's story really hits home for a lot of people, tying into the national talk about falling birth rates and the financial squeeze on American families. Sure, hospitals see and turn away uninsured folks, but they absolutely can bill them, leading to crippling medical debt that can wreck credit scores and financial stability for years. This whole system, where insurance companies and providers haggle over prices in secret, leaves patients completely in the dark, often getting hit with huge initial bills that look nothing like the final price. We really need to think about what this kind of system means for society as a whole. If having a baby is loaded with financial stress, what does that say about our future? In most other developed countries, childbirth is pretty much covered as a basic healthcare right, not some fancy extra. The money worries tied to birth in the U.S. can seriously mess with new parents' heads, pulling them away from the happiness of having a baby and straight into debt anxiety. It forces families to make tough calls about how many kids to have, their careers, and even their whole financial future. Emily's experience isn't just a one-off. It's a clear sign of a much bigger problem with the system. Her story makes us really think about the kind of society we're creating for our kids and grandkids. Should the amazing act of birth lead to financial disaster, or should it be a celebrated moment backed by a healthcare system that cares more about people's well-being than making money? How we answer that will shape the future of our families and our country.